So let us discuss about the lateral wall of nasal cavity. It is divided into right and left halves by the nasal septum. So this is how the nasal cavity, and this is the nasal septum. It divides into right and left half. Each half has roof, floor, medial wall, and lateral wall. Each floor has roof, floor, medial wall, and lateral wall. So here, if I draw in this way, so this becomes the roof. This is the nasal cavity, roof and floor. Roof is formed by, this is a frontal bone, sloping surface, ethmoid and sphenoid bone. And floor is formed by the hard palate, that is maxilla and palatine bone. And coming to the lateral wall, it is having three parts. It is vestibule in the anterior part. In the middle, this is the atrium, and posteriorly this is concus. And vestibule has some short hair like called vibrissae, and atrium is limited by some raised ridge, that is agarnaceae, and posterior part has concus and meatus. And actually it is formed partly by the bone, cartilages and soft tissue. The bones that forms are the nasal bones, maxilla, part of the maxilla, ethmoid, not full ethmoid, part of that, inferior nasal concha, palatine bone, medial pterygoid plate. And the cartilages are superior nasal cartilage, inferior nasal cartilage, and 3 to 4 small cartilages of the ala. And the features are the concas and meatus are there. Concas are superior concha, middle concha, and inferior concha. Meatus are superior, middle, and inferior meatuses, and in sphenoethmoidal recesses there. So they are present below the superior concha is the superior meatus. Below the middle concha is the middle meatus. Below the inferior concha is the inferior meatus. And the openings into them we shall discuss here, like mostly we shall go with middle meatus. Middle meatus has a number of structures to be discussed here. So there is a first feature under the middle meatus. We have ethmoidal bulla. Ethmoidal bulla is raised elevation, and because of the middle ethmoidal sinus opening. And just because there is a raised elevation, there is a sulcus here. That sulcus is called as hiatus semilunaris. And this hiatus semilunaris has anteriorly, there is a passage, short passage, that is called as infundibulum. And the sinuses which are present or opening into the middle meatus, the sinuses, we have paranasal air sinuses are there around the nose. So they are frontal sinus, ethmoidal sinus, maxillary, and sphenoidal sinus. Here the frontal sinus will open, anterior ethmoidal sinus and maxillary sinus, and middle. So I have drawn a diagram here. So this is superior concha, middle concha, and inferior concha. This is what is this? Below the superior concha is the inferior concha is the inferior meatus. Below the middle concha is the middle meatus. This is superior meatus. So into the inferior meatus there is nasolacrimal duct will open. Into the middle meatus, frontal sinus, anterior ethmoidal, middle ethmoidal, and maxillary sinus will open. Into the superior meatus, posterior ethmoidal sinus will open. And there is a recess here, sphenoethmoidal recess here. Between the ethmoid and sphenoid, there is sphenoethmoidal recess. Into this, sphenoidal air sinus will open. Sphenoidal air sinus. And coming to the blood supply of this, so this is the lateral wall of the nasal cavity. It is having a superior part, inferior part, anteriorly and posteriorly. This is divided into 4 quadrants. If you draw an imaginary lines here, vertically and horizontally. So this part between anterior and superior, this is called as anterior-superior part. Between the anterior and inferior, this is anterior-inferior part. Between the superior and posterior, this is the superior-posterior part. This is inferior-posterior part. So we shall see what are the arteries that supply them. So anterior superiorly, you have 2 arteries, anterior ethmoidal, posterior ethmoidal. This is formed by ethmoid bone, so you can remember this way. And anterior inferiorly, there is facial artery will be supplying here. And postero superiorly, it is supplied by sphenopalatine artery. And postero inferiorly, it is supplied by the greater palatine artery. This is a palatine bone formed by the palatine bone. So related to the palatine artery, you can remember that. Now, venous drainage is anteriorly drains into the facial vein, posteriorly drains into the pharyngeal venous plexus, and middle they are draining into the pterygoid venous plexus. And the nerve supply is, see, just like the blood supply, it is divided into four quadrants. So anterosuperiorly, the nerve is anteroethmoidal nerve. Anteroinferiorly, the nerve is anterosuperior alveolar nerve. Superior alveolar. Here alveolar process is there. So we'll call them as anterosuperior alveolar nerve. Posterosuperiorly, it is a lateral wall. So it starts with lateral, posterior, superior, posterior, superior, nasal branches. This is the nasal part, no? Nasal branches. Here we have anterior palatine nerve. These are general sensory nerves, whereas special sensory, which takes the olfactory, the nerves is the olfactory nerve. They take the sensations of the smell. And lymphatic drainage is, it is drains into the submandibular lymph nodes anteriorly, and posteriorly they drain into retropharyngeal or upper deep cervical lymph nodes.